So sometimes when we sit together, I say them, oh, I'm made in Jimma University. So so I feel very great honor to be here in my university. And this shows that Jimma University is contributing very much to academic staff and academic vice dean, as well as dean of Mizanam and Health Science College, which was a regional health science college under the previous region, which was called the Southern Nations, Nationals and Peoples Region. So this is my background. So saying this, I would like to reflect on the issue what Professor Zunel raised. So you know that as the presenter said, there is a very big gap in evidence to policy translation in our health system. So the Ministry of Health is working on this issue currently. What we are doing is we are trying to bring together the health system and the academic institutions. If you look at our academic institutions are acting independently. So at least we have to create collaboration, linkages, networks between among our academic institutions. Otherwise, it will be very difficult. It will be very difficult. You know that our academic institutions are producing hundreds of articles. For that matter, high level, high quality articles in quality journals. So they publish hundreds of articles every year. But how many of those articles, how many of those research findings are being used by policymakers? So this is the very important question we should answer. So our research processes end at the dissemination stage. So as the presenter said, we don't have this say, publish or perish. Once you publish, you forget it. So those research papers, how many of those are being used for policymaking, for decisions, and so on? So after recognizing this gap, the Ministry of Health established an office called Policy, Strategy, and Research Lead Executive Office in 2023. It is almost 2 or 3 years back. And we are trying to work on the evidence-informed decision-making system. So we envision to see functional evidence-informed decision-making system where the health system uses the available or the best available evidence to make decisions, to develop policies and so on. So in my speech, when I say policy, I'm saying, I'm referring to strategies, roadmaps, protocols, or whatever we are using in our institution, in the health system, to make decisions or to operate our day-to-day activities. So that to do this, the Ministry of Health has started working on developing national research roadmap and national research priority agenda. So we developed the national research roadmap and the national research priority agenda. So in this process, we involved different stakeholders, including representatives from the 8 research universities, representatives from regional health bureaus, from regional public health institutes, from Armor Hansen Research Institutes, Institute, from the Ethiopian Public Health Institute and other national and international NGOs. So with those stakeholders, we try to develop the national research roadmap as well as the national research priority agenda. So so now it is in its finalization stage. Once it is finalized, we will cascade this national health research priorities to all of the universities in Ethiopia, to all of the research institutes in Ethiopia, so that the universities align their research priorities in line with the national health research priority. And the other thing is to facilitate the coordination between, or the networking between the universities, academic institutions, and the regional health bureaus. We formed Health Evidence Network Ethiopia. Previously, this Health Evidence Network Ethiopia was focused on the Ethiopian Public Health Institute and the Armor Hansen Research Institute and the Ministry of Health only. Now we are trying to include the 8 research universities, the regional health bureaus, and the regional public health institutes, so that we just work together and we will be on the same page regarding this evidence translation practices. And also, we are trying to establish knowledge translation units in each universities. Now, after this, after this conference, we will have a discussion with the staff here, and at least the university leadership takes the commitment to assign at least a focal person for the knowledge translation unit in our existing research structure. So this is what the Ministry of Health is currently doing. We are trying to just narrow the gap in evidence to policy translation. Thank you.
Excellent. That's a very useful information. I'm sure the audience is probably digesting this information and trying to see what do I fit here and how do I be part of this activity. So my next question will be to Professor Mulumabet. I don't think she has to be introduced to you. She's your family, so I would probably ask her to go directly to the reflection. If you want to add some more information about yourself, that's okay. So you've seen the presentation, and also based on your experience, tell us what the current structure looks like in JU with regard to evidence translation or making research impactful to the community, the nearby and beyond. So give us your current the reflection on current structure and policies and governance.
Okay, thank you very much. I hope everybody knows me. I don't want to introduce myself for this team. As you mentioned, the current experience, Jimma University or any universities currently, we are in the fourth revolution for the universities, from teaching learning to research focus and commercialization at the end, but we need to have societal impact, otherwise there is no growth in development for the universities and we will not make it. So for that, in Jimma University, we do the research will be conducted with internal support as well as the external support, staff involved in different research activities. Structurally, from the research and partnership vice president to the college level, we have a structure, a research director at the center, and research coordinators. And besides the research director and research coordinators at the college level, we do have other directors under the research vice president, community engagement director, and university industry linkage technology transfer director. For me, these two are the most important to translate or to reach the community with impactful research. but we don't have a specific unit or responsible person for evidence translation. So we do it in informal way, ad hoc way. For example, if it's a project that needs to be reported, they have to have an impact in the policy briefs, reach to the community, discuss with the community, and come up with those evidences that has been translated. In most of the research directive, we do have research directives and guidelines for community service. In this research directive, we encourage researchers to involve stakeholders from problem identification to utilization, but it's not properly done. For this, for example, for staff students doing research, and we have repositories for student research, and we'll ask when we give mega project and innovation project fundings, we ask them to bring publication as well as policy brief. But there is no way to link that policy brief to the responsible system in the government system, specifically for this discussion, the Ministry of Health. So this is one lacking gap, and individual efforts are there to communicate with the ministry, to work with the ministry. Otherwise, at system level, only this informal communication are there. Like when they call us, as Dr. Sakarmani mentioned, they call us when they try to develop these research priorities and for some information. Otherwise, there is no direct linkage between university and Ministry of Health to share those findings, to work together. So that has to be a system. But as I said, individual projects, like I can proudly mention capacity building mentorship program, in which we work with the Ministry of Health planning department and for information revolution and data management. That's a system built between the university, regional health bureaus, Ministry of Health, and district level. So if there is a system linking or the university industry linkage going beyond only focusing on the technology aspect, all systems for the health, Ministry of Health is the industry, for people in agriculture, the agriculture minister in the like are the industry. So we were working towards to link this and to make evidence reach to the community and changing the life of the community. And what assignments will take now is that, as mentioned, these systems to have a focal person, like if I mention the challenge, structurally there is no structure in terms of incentive for the people who are coordinating there, in terms of leading that particular thing. So having a focal person in this two units, university industry linkage and research publication extension office, to bridge the gap between evidence generation, where we end up only publication, to reach the community and bring impactful effect on the community life. So the current practice, we have the repository, we ask the documents, policy briefs, but those policy briefs are left on the shelf of the coordinators if are not reaching the library. Thank you.
Thank you very much. That's also very useful information. I mean, as a faculty, as has been here, we've tried individual, we had individual efforts in being involved in research. For example, I have been leading the JUCAN for almost 10 years before I left, and it's still active. But it is when I went to Addis that I noticed the major departure. We just keep on churning papers after papers, papers after papers, but none of it is arriving on the desk of the policymakers. In fact, I have sent a policy brief, but nobody knows about that policy brief. I checked when I went to the ministry, I checked about my policy brief. Nobody has seen it. So we assume that things will move by themselves. Once we have done and published, when then people will be there to uptake and utilize them. But that's not the reality. And that is what motivated us, I, myself, Murkuze, and our other teams to really invest on this. And we've been working in this space for almost 10 years. And I can take some, in terms of the privilege of saying we have been behind in establishing the PSR for the ministry to establish this type of structure. And then part of these activities of cascading this structure into universities is now what we're doing. So I think there is a lot that has been done, but as you said, there is also a lot that remains to be done. So I will move with this small note. I will move to Professor Murkuze. So we've seen this gap, over the last 10 years we have been in this space. So tell us your observations and what has been done to really, alleviate or mitigate this challenge so far, based on what you are actually doing. Okay.
Thank you so much, Professor Samir. So one note I would like to make before I mention what we did to really address this gap is the fact that we are not exaggerating this issue. We understand that not all academic research should be translated to policy practice. It's like the Pareto rule. If 20% of the academic research outputs can really influence policy and practice somehow, that will be something optimal. We understand that majority of the knowledge that's generated in academia is meant to expand knowledge, is meant to contribute to the pool of knowledge that exists in that particular field. So we are talking about making sure that we have the opportunity of generating evidence within the academia to make sure that we impact policy and practice in our field of activity. So FNOT project, since its existence in the last 10, 12 years, it has been trying to bridge this gap by creating boundary organizations, which are a kind of intentional groups created by bringing together researchers, policymakers, and partners working with policymakers. By policymakers, I'm referring to people from Ministry of Health, Regional Health Bureaus, Zonal Health Departments. These are people who design and in the maternal and child health department, we supported the research advisory council as a scientific advisory panel. What do these platforms do? They receive policy relevant research questions from the program managers, the academics and the policymakers sit together to prioritize the research question, frame it, and supported by the scientific skill of the researchers, do evidence synthesis, sometimes conduct analysis of existing data, and so on. Then come up with the evidence to inform decisions. So they inform introduction of new interventions. For example, the Research Advisory Council at the Maternal and Child Health Department informed the cost effectiveness of introducing a birth dose of hepatitis B vaccine in Ethiopia. Then it recommended its introduction, and it recommended that it is cost effective after conducting a modeling exercise to determine cost effectiveness. Then it was piloted in 4 regions. Now it's scaled up. It has now become part of the routine vaccination program in Ethiopia. So similar exercises have been done at regional level. We are trying to expand these boundary organizations, which sit between the academia and the health system, to facilitate interaction, collaboration, and co-creation of evidence to inform decision-making, to inform implementation of programs. So what we have learned so far while trying to create these connecting organizations is these organizations should dwell in problem-driven research questions, not project-driven. You know, in academia, what we do is we set up a research team, come up with a research question, probably based on the call that we have received from funders. Then we conduct our study. But the research question should begin from the users, the end users, the policymakers, if it is by the policymakers to inform decision making. And these platforms make the translation process more intentional, informed by the demand of the policymakers, and ensure that ultimately it shapes the policy making process. So that's what we have learned, and it should not be like perceived, as I said in my opening. We are not trying to say every research should make it to translation, but those which are supposed to be impact policy should begin by assessing the need of the health system, the need of the development sectors that we want to affect. Then it will be highly likely that they demand the outcome even before you publish it. And that's what you want if you are, translation-oriented researcher. Thank you.
Thank you, Marcus. That's a good note. I agree. We're not asking all research to end up on policy or practice, because research has its own purpose. In universities, it can be a means for skill building, teaching students on how to critically think, to ask questions, develop data, develop information, knowledge, and so on. So we're not pushing for every research to be done with an intention of being translated. But I think the overarching aim should be research should make people's make life better. That is the whole point. Professor Daniel, I think you've heard that since we don't have institutionalized mechanisms or formal mechanisms that encourage or gives the opportunity for researchers to do impactful research, individuals are taking their own initiatives. We're not saying there aren't any impactful research, but there are, but they are not systematic. So you're here representing the audience here, the research community. So based on your experience, tell us your observations, how you navigate this, unsystematic, uncharted territory in terms of generating a research question, developing the evidence, and in taking that evidence to the policymakers. Your personal experience or your team experience.
Sorry. Thank you very much, the organizers, and also the FNOT project, and also Professor Tunel and the team for this invitation and for raising this important topic, and on the time that I can at least talk a little bit with my very little experience. So I just go through my experience as a researcher and try to show what's the lacking, but it has already been, on the presentation, all have been picked. So I started with Professor Tunel with the UNIT JUCAN project in a clinical trial in HIV patients, my studies. So when I start that one, then I know my aim is publication, getting out the publication, but I don't have any knowledge of evidence translation, getting to the policy, and making it to the guideline. All these things, no knowledge. So I haven't taken that kind of courses in any of my medical, as a medical student in the curriculum. Just to show you one of the gap that we have in our curriculum, that what we need is, what we encourage is for publication to come, but we don't know, well, later on, the impact it will bring. So that's one thing. Then I started working in the research, and we started, we finished the trial, and we decided to write a policy brief, and we wrote the policy brief. Then we don't know where to send it, the policy brief, whom to send it, whom to communicate with. So we just said that there is a nutritional advisor for the Minister of Health. So why don't we send an email for him? Then we sent for him. And he read it, then he don't respond. And we started to communicate with Spawn. Then also it doesn't go well. So this shows that there is no pathway, that gets you and link you, the academicians, to the policymakers. And they do not usually sit together. They don't co-create proposals. So they don't understand what we are sending also. And they don't take it for any grant, the research. So this shows that the pathway is not there for the academician to go to the policymakers and change the policy. So I established a clinical trial unit with the team and started working on malaria. And then that was also a trial, a drug trial. Then we saw that the drug was a new drug, it was effective. But, it's not about the mistrust that we see, is not only about the methodology, the design, but sometimes the policymakers have also a mistrust whom we are working with, partnered with, and are we really caring for the people, or are we just because of with the industry linkage that we have, we are trying, to manipulate this. So the mistrust is not, it's the box that is seen as academician, that the box we are in and the box where the policymakers are in are different. So it's very crucial to understand the perspectives of each other. So we need to have both hats to understand it. Otherwise, usually there will be always a blame. We, the academicians, blame the policymakers blame us for different things. So there is no any connection, and we are wearing different hats and exercising different activities. So then I also worked, then I started, okay, then I saw, let me give you the real malaria case. Primaquine is for Vivax malaria. It is a relapse prevention. So Primaquine was in old days used in Ethiopia, but later it was stopped by the Ministry of Health. We don't know, still we don't know the reason. Then when I do the trial, I did the trial on other drugs and Primaquine, but Primaquine was effective. And when we see why it was not provided was because there is a G6PD deficiency, which is an enzyme. But when we screen that one, that's not that much. That's not available. In Jimma, it's not available. In Gambela, very few in its wild type. Then why did we stop? Then how could we now convince? And one of the patients that we have in the trial, when we include him, he was going to discontinue his education because he has a very frequent relapses. Then I just decided, then how could we communicate and make them, the Minister of Health, convince the Primaquine inclusion in the guideline. So I considered myself as a malaria expert, and I started to write an email for the Ministry of Health that I should be involved in the Ministry of Health guideline development. And also I can contribute and I can learn from the exercise. Then I organized workshop also with the trial. Then it's not the trial drug that I, encourage to start, but the pre-mark that we were using previously should be included. Then that was later on I also just tried to push, but the Ministry of Health, the leadership also believed in it, and we included again the pre-mark in the study. So that shows that we need to have both sides to understand. So I understand them well when I get them and why they are using that one. The other thing is misalignment. It's true. So we need a research, and we do research based on the funding that we get. And we are also, if you have heard, because of the funding the government is getting, they are deciding on the funding. So it's a different two exercises, two different activities. So there is a misalignment. How many of us have participated in the review meeting of the regional health bureaus meetings in like malaria, in HIV, in tuberculosis, like that? So we usually present our research, and usually do the review meeting separately. So we don't know the questions they have. We do our questions there, they have the questions, but working together, we can identify the questions. That's what I learned. So, and it's good that if you were here yesterday, one of the community health-based insurance that was raised, the question raised from the policymakers, then gets to down. And it's a very good research that I have found. So, and that misalignment is there, and that link should be there. The other one, sorry, I have to go faster, the funding issue. Once, as I agree, I also underline that what Professor Zunel and Professor Mukuze said, that all research should not go to the policy. They may be in the process. They may be the first part that goes to later on to the policy, knowledge creation. There are different developments before we go to that one. So when we do the clinical trial, then what we found is the study is the drug is effective, but is it feasible in our country, in our context? Now I have been involved in both the malaria guideline in the national and at WHO. So in the WHO, I recommend that one. But in national guideline, our context is different. Do we have the budget? What is our population size? Do we have in all regions, can we, there are a lot of things that we see in the politics and also at the Ministry of Health level and regional health level in their box. So that's not the recommendation that we give. So the alternative treatment is better now in our country. So we just recommend that one. So I think it's important to see that one. And sometimes before going the trial to the policy, there is a need for implementation studies. And sometimes you don't find the funding for that one. So that exercise also should be developed. The other one is evidence usage at the policy level, as it has been mentioned well. Then the skill development is not only at the curriculum level, always it should be continuous development that are found at the ministry, regional health bureau, and at the academic institution. Motivation, as I said, there is no motivation that puts me to go to the Ministry of Health and ask that I need to be in the case management team. Now I'm in the case management team, but that's the email that I write to the Ministry of Health team members that I know that I should be included and contribute to the malaria guideline. So there is no motivation in academic level that gives you to that direction, but that's a self-motivation. But if there is a unit that matters for motivation, many people may prefer to go that pathway. Okay, thank you very much. I took no time.
Yeah, thank you very much for sharing your personal experiences. I think individual motivations are important, but to make it wider practice or a broader practice, we need some system level push. Recently, I'm being contacted with more of my students for being involved in the research, medical students who have graduated from here. And I was curious, why are more medical graduates being interested in research? And they're coming to me, Professor Samuel, I want to get in research, be involved in here and there. And eventually, after a year, they will come back and say, can you write me a recommendation? Because I'm applying for USMLE in the US. Okay, now I started to connect the two. So what I found was there is a recent change in the US medical education for foreign students. One of the criteria for getting a better mark is being involved in research activity. So that is driving, it's a national, it's external factor, but now it's motivating our medical graduates to get involved in research. Previously, nobody was really, motivated at this scale. So I think we need to have some push in addition to individual motivations to bring more impact. So I think we've given one round of question and reflection from the panels. So let me open the floor for questions or reflections to the audience. So for the sake of time, I'll limit it to 5 questions or reflections. Please raise your hand. So first come, first served. I see one hand. I cannot take 5 from on one side only. So I saw one hand there, one hand over there, 1, 2, 3. Yeah, 3. As in my challenge. Okay, it's tough. 4 and yeah. Fair lemon. 4. Okay, so 5. I'm sorry. አውቃቸዋለሁ ወደራችሁን? Okay.
Okay. Thank you very much for giving me the chance. So I am Shumi from Sabah Science and Technology University. So thank you all the panelists and the presenter as well. You pick one of the most important topic, I think, that interests a lot of stakeholders actually. So I really appreciate the topic of the discussion. So having said this, I do have only one opinion on the research findings. So based on your analysis, so you come up with a number of recommendations, and one of the recommendations you come up with was, institutional structure is important. So in translating these evidences into actions. So my issue here is that, I think it was before 2 years or something, if I am not mistaken, the Ministry of Education was also trying to establish these kinds of institutional framework. And I think it was university-industry linkage supposed to manage these kinds of responsibilities. So in your research, I think why you didn't therefore consult these kinds of institutional units, because in all universities, I think the Ministry of Education mandated, it is a must, I think, for all universities to have this unit, university-industry linkage. So this university-industry linkage is, I think, primarily used to work, identifying problems together with industries and doing research and concrete solutions as well. So while there are these kinds of institutional frameworks or units, why therefore your research come up with the same solution? I mean, as a recommendation, you come up with units are important, and these units must be mandated to translate these research findings into action. So why your research didn't therefore consult university industry linkage as one important unit that can translate research findings into action. So this is my issue. Thank you.
So why did our finding this? Yeah. Good. For the sake of time, shorten your questions only to one and make it fast. Yes.
Thank you. Great to have you among us, professors. Professor. In fact, Professor Sunway was my advisor at undergraduate. Now, Professor Murkuze, department colleague and supervisor at PhD. So I am one of the staff who got chance of involving in this evidence to policy while working on HIV. So we have learned that in that process, we have learned the two hats, what those on service area or in policy area think and what we have think. We have learned more that, and we have engaged the role of being involved in each process. So as a result of the research we have conducted by your support and the guidance, they reached to the level of making to intervention by making campaigns and changing it to project. Thank you. So my question here is, it's a good start. Ministry of Health also have said much, but the Ministry of Health is higher, too far. But still, locally, evidences are very important. And Ethiopia is a diverse setting, diverse health system. AI is also appearing, and the changes are being dynamic more than ever, and human capacities are also evolving. So how can we cascade this to the level of local level, at even region, at zonal, even to the Warada level, because there are also educated staffs in terms of capacity there, and how can we reach them is one of my question. The other is,
For the sake of that, I have to limit you to one.
thank you, thank you.
Sorry for the interruption. Okay. With the third person, okay, over here. Apologies for the interruption, just for the sake of that.
Thank you all. My question is very short. What will be the best solution then if there is a gap between the research output or finding and utilized by policy briefing for the future not to be continued by creating the gap? What is the best solution in the future?
Next question is here.
Thank you very much. My name is Dr. Lata from College of Business and Economics here, Jimma University. So I really appreciate your experience, your research activity. It's a very important area. My question and my worry is there has been no demand from the government side for the knowledge of the academicians. That is why you all have been sharing your experiences. Professor Samuel has tried to send the policy briefs and then nothing. Professor Daniel also. So how can we make the government build trust and come for the knowledge that will be generated from the universities? So I should say that we should not blame ourselves. It's not, we have been doing a lot, but there was no demand from the government side. That was, so how can we build that trust and come to the universities to ask for guidance? Thank you very much.
So creating the demand, building the trust between the two partners. Great. Still, and then.
Okay. Thank you. Thank you very much. I'm Professor Saifa from Addis Ababa University, College of Health Science, of course, Radiology Department, Medical Physics. This is a very timely, presentation, but it has to be a little bit very long, maybe it has to be a one-day presentation or something like that. It is very critical because, the issue is very important. I would like to thank the presenters, of course, the Jimma universities as well, and of course the Ethiopian Journal of Health Science, for which I used to publish here. They are the leader in these areas, of course. Of course, I'm not thinking that putting, forwarding our publication to policymakers is very easy for me because we are working, for example, currently on national diagnostic reference levels for cities. Sorry, this is a sort of information. I feel as if, we are doing that. We are going to present this maybe next year or something like that. This is, it is very good and very interesting that to know the path is very long, okay? Therefore, having this, I think this is very, very critical. This is not a comment, of course. This is just to say that I'm happy to have such things, but the discussion should be very long and so on. That's all what I have, In Addis Ababa, we have, of course, the culture of publication. We have incentive, all these things. Thank you very much. I think we need a very long presentation in the future. That's all what I want to say. Thank you very much.
Thank you. So give more time for this topic, given its importance. Okay. Last. And then after I will give you a very special opportunity.
Okay, thank you very much. My name is Iyob Satu. I'm the director of ICD Africa. It's a research institution that works with various ministries and academic institutions. I first appreciate the ideas raised from the table and of course the initiative taken as the universities are going out of the political arena with this autonomy. But just to give a brief comment is, as you mentioned, not all the research is conducted has to come to the practice and to the ministries is real. Of course, there are many research that are conducted for academic purpose, for testing of theories that end up in the universities and at the level of Ministry of Education is fine. But yes, the policy briefs and the various recommendations first has to root on the priorities of Ministry of Health so that they should be included in the policy process is my first comment. Secondly, we need more finance and more money for research as Africa funds only 1% for research per GDP is really very lowest that we have to really rethink. And we of course need very strong platform, more broader than your advisory panel is really relevant to substantiate this initiative, probably including institutions like policy studies institutes at the national and the federal level. Thank you.
Thank you. Maybe you have a chance. Yeah. So
Okay.
I probably confused you when I indicated.
Okay. Thank you for giving me the chance, and thank you for bringing the issue for discussion. My question is, probably when you do this research, you have looked into different countries' practice, who made the best use of evidence translation. Can you give us, if you come across countries or institutions that best used evidence for decision making, for policy, and what lesson we can take to our context? Thank you so much.
Thank you very much. So I think we'll close the session for the audience. It's not that we don't have important questions because of time. Time is always non-renewable resource, right? So I think take any questions that you think will be responded from your side, and add to that reflections to my question, around second round of questions. Okay. So, okay, you can start. You can start. You can start.
Okay.
My question would be,
okay.
You know, you can also respond to Dasta's question. What should be the best, you know, in terms of the researcher's perspective? What should be done, you know, to sort of alleviate or sort of give some sort of solution to the challenges you mentioned from the researcher's perspective, not from the leadership or governance perspective?
Okay. So, just to answer the question, what I learned first for the solution is one of I mentioned about the Minister of Health. The other is during COVID-19. What we learned a lot is by the FNOT project. Then the academicians were, connected with. That was a very hard, very difficult environment. So the academicians joined with the Oromia Regional Health Bureaus to work on the COVID-19. Because there is no any kind of treatment at that time. There are no effective known solutions. So that time we worked together. At that time we have learned as a researcher, we have learned a lot from the regional health bureaus. And they also learned with us. And also some of them also entered to the academic environments again and worked with us. That kind of linkage is very crucial. It's as a researcher, what we have to do is, it's good that for academic purpose that we do, but we have to also work closely with the policy makers, identify what are the thematic area, what are the problems on the specific field that we are working. For example, if I am working with malaria, that's the mostly that I'm working, then I have to work closely with the regional health offices, the Minister of Health together in the co-creation of starting from the proposals and getting to the solution. That is the very important thing that as academicians that we do, and also work closely with our leadership, to install that culture and the system. So we need to develop a system in our institution where we are working, not only solely working outside, but we have to be the part of the solutions in creating the system. That's what I said. And what I just also need to put one question is, it's not because there is no demand of or requirements from the governments or the Ministry of Health or from the regional health bureau. That's what we think of. And they say that our research are not coming. So it's because we don't have the link to work together. Otherwise, there are a lot of problems that we require funding. We apply for a lot of problems now, but the fundings that requires the funding should be also locally funded, because for the contextual problem, you may not get the funding from the outside. So if we work together, that's what we learned, that Oromia Regional Health Bureau funded the research, and we did the research together and give the solution together. So I think it's not because there is no demand, but because there is no that linkage. That is it. Thank you very much.
Thank you very much. Just to add, because of this, you don't believe it. Health Bureau allocated 10 million for research. 10 million. Can you imagine? Here we try saying, okay, only 60,000 for PhD student. 10 million for one. Just because we work together. Professor Mulu. So take one question from the audience, and then my question is, my point is, academic promotion incentive has been raised as an important issue. What is your take on that? What can be done, to improve that?
Okay, thank you very much. I would like to thank all the audience raising very important issues. To reflect on few, like the demand part, we should be proactive in our all system. If we are working in the health system, we need to be proactive and engage them, as said from the beginning. If we work together, we build trust. But if we call them at the end of our work and saying that this is dissemination, they will not trust, they will not use the evidence for decision making. So that is one thing. Still, what is the best solution? Collaboration and working together is very important. Structure, having units, this may give the conducive environment to work, but collaboration and commitment is key to achieve what we want to do. In terms of the incentive promotion, as we all know, in the promotion guideline, this policy brief, or what is the impact for the community, not measured. So that has to be partly revising the guideline and including it that, we have 100 publications, but what was the impact for the community has to be considered. This is my personal opinion. To do that, the very challenge in our current situation is we don't have metrics. One university may say that impact is maybe going there and discussing with them and giving them the result. The other say that how many people are, how many % of the population livelihood is changed. So these are two different things, which makes the people demotivated to be promoted. So one can be easily promoted, the other will not be. So we need to have a clear indicator matrix and guideline to do that. If we do like that, people will be motivated to bring changes for the community. And if we work with any stakeholders from the identification of problem to the translation and using of the output for policy making, changing the lives, that will be the best way. Thank you.
Very much. So we agree in principle that we need a proper measure and metrics to be more objective and systematic. Thank you very much. Dr. Takli, so there are questions raised about demand from the programmers and also trust, and then also capacity and so on. So give us also your take on how do you what are the fine tunings that should happen to align? Because you said there is a research priority, but how can you cascade it down? You said we'll cascade it down, but the how part, what are you planning to in that regard?
Thank you. First of all, I would like to raise a couple of things on how to foster a culture of trust in local research. So as we also have seen in the presentation by Ephraim, we have seen there is trust in the locally available evidence or the locally generated research evidence. So in my opinion, the first thing we need to do is we have to work on strengthening the local research capacity. So that means we have to invest in training our local researchers, and we have to work on different capacity building programs. In our universities, there are senior professors and senior scientists, even though they may be few in numbers. So we have to map those professors and senior scientists, and we have to use them to train our junior researchers and so on. So we have to work on capacitating our researchers. And also we have to establish mentorship and collaboration networks between our universities. Our universities do have resources in this respect, human resources. So this is what we can do. And the other thing is we have to promote transparency and open data. I want also your opinion in this regard, because ethical issues are being raised when we talk about this transparency and open data use. Can we use the available data in our universities freely at this time? There are different data sources. For example, in our postgraduate programs, master's and PhD programs, as well as different grand researches, there are data available, data is available. So can we use, do you have access to those data? So there are...
Sorry for interruption. See it also the other way around.
Yeah.
Can the universities access routine data from the health system? Because there is a huge amount of data health system, in the health system for training and research.
Okay.
Let's reflect on that as well.
Great. So, in my opinion, to do this, I think we should develop a clear policy where we can use and access those data. Now, such kind of policies are not existing. Such kind of policies, how to use those data, how can we have access to those data? So we should have a policy at the national level regarding this issue. This is my opinion on this matter. And the other thing, in my opinion, is we have to institutionalize evidence-informed policy making. Currently, what we are doing at the ministry level is we collected all the available policy documents in the ministry. We collected more than 400 documents. What I mean is the strategies, the policies, the protocols, and so on. So we try to see how many of those documents are informed by the best available evidence. Almost most of the policy documents are lacking using such evidence. Can you imagine? We are a ministry, at a ministry level, whatever document we produce, whatever policy document we produce should properly utilize the best available local and international evidence. Even some documents, some policy documents are lacking references. Fragmented structures, no uniform guideline. So we are trying to work on those documents nowadays. And also, for example, if you join a ministry, when I joined Ministry of Health as policy, strategy, and research analyst, I couldn't get any access to different existing guidelines, existing strategies and roadmaps, because those documents are not available online. So that we have already started developing an integrated digital repository system where we can upload all those documents and everybody can access those documents. So institutionalizing and developing a guideline that mandates our leaders and our health system to use locally available evidence or internationally available evidence is very important. So that means we should also have a kind of policy.
Thank you very much. I think, I know you have a lot to say, just I'm being told that we are running out of time. So
okay.
Maybe if you have one point, maybe you can add, otherwise we can.
Okay. Regarding the alignment, what you raised, I think one important thing I want to raise is I think we should have a structured stakeholder engagement where multi-stakeholder committees can be formed from official by which involves individuals from the ministries, from the research institutions, from universities, from regional health bureaus, and so on. In such a way, this can oversee whether the university research plans are in line with the national health priorities or not, so we can monitor in that way. Thank you.
Thank you very much. So, Markuze, I would like you to take two of the questions. One on best global experience, and then one question about cascading it at zonal level or sub-regional level, this activity.
Thank you. So,
sorry. Yeah. So I will take that probably, but probably you can also respond to the question. Why our study missed the university industry linkage unit or unit
structure. Yes, I can start from that one. We have not missed it. We have picked it. What we have understood is that the structure exists, but there is no intentional. They said, the people we talked to said, it is in the job description, there is no clear indication of the evidence to policy issues. So people we talked to in the validation workshops, they recommended that it has to be part of like the job description or part of the terms of reference of that department. About the subnational cascading it to the subnational level, I think we are trying to do it with, for example, the Oromia Regional Health Bureau. You have seen Ambo and Hawassa in the presentation. So after the landscape assessment in Ambo, we have worked with the West Shoa Zonal Health Department and with Ambo University. So they worked to identify community health problems. They are working, co-creating the evidence to address priority problems in that particular zone. So we are really proud to see that this idea of using evidence to inform decision making we are promoting at national and regional level is going down to the district level. So what is the solution? The solution is to create a bridging platform such as the one we have created in Oromia and in the national level. That's what we did in Ambo. So create a platform, you know, a space to really interact. Professor Daniel was repeatedly mentioning that there is a lack of opportunity for connecting the two worlds. So create that platform, and why not arrange for joint appointment for policymakers? You know, gives them the opportunity to share their experience in your classes, for example. In that way, they will not only have the opportunity to you know, engage in only research, but in the teaching process. You will be amazed to see the, you know, the level of knowledge and experience they have gathered while designing and implementing health programs. So it will be beyond the textbooks, your lecture, if you do so. Another very important issue, which was asked by one of the participants, is how can we, you know, what's the solution? So apart from creating this platform, capacity building is essential for both researchers and policymakers. And we should stop blaming each other. What the solution is for the researchers to learn how to interact with with policymakers, how to package evidence, how to co-create evidence to win the heart of policymakers. And for the policymakers to learn how to translate evidence, how to, you know, assess its credibility and use it to inform decision making. In this way, we can stop blaming each other, you know, create demand easily, and use the opportunity to build our own capacity and support the health system managers at the same time.
Okay, we're under time pressure. I mean, the best experiences, maybe Dr. Kaab told, we can share you a review we have done a few years back to see best global experiences. One of the places is Thailand. In fact, we had arranged experience sharing visits with the ministry staff there in Thailand. They have an excellent system, so we can share you that material. It's also available on our website, on FNOT's website. You can access it from there. So with this, I think we have to conclude our panel. And I thank everyone for their nice